So thanks very much everybody for inviting us to speak at today's webinar. Darsha and I are going to talk to you about the Wakefield District Experience of Care Network. Our colleague Nick from Local Health Watch, who is referenced on that slide, isn't able to be with us, but he's a vital cog in our network, and it's just a shame he can't be with us to help share our experience of developing the network. So a little bit about Wakefield. It's a district made up of the cathedral city of Wakefield, as well as towns and villages with plenty of history and heritage. It's famous for rhubarb, rugby league, horse racing, Haribo sweets. It's the birthplace of Henry Moore and Barbara Hepworth. And of course, there lives the fabulous Jane MacDonald. But some facts there about Wakefield district and the people, the health of the people in Wakefield district. Access to health and care isn't the most important determinant of health in Wakefield. Poverty, inequality, education, work opportunities, family life, and those other determinants have as great an effect. So just a little bit of background about Wakefield District Health and Care Partnership. We work together to improve the health and well-being of the local people of Wakefield by reducing health inequalities, providing continuity of care and improving services. And we want to support our residents to start well, live well and age well. Our district has quite a forward-thinking approach to integrated working or joined up working across health and care. So the partnership includes our NHS organisations, Wakefield Council, Health Watch Wakefield, and then working alongside housing organisations and the voluntary and community sector. So we've got a long history of successful partnership working, and that system working is about putting people at the heart of our decisions, our priorities and our work. What else is unique about how we operate across our partnership is our place accountable officer. So our lead for the Integrated Care Board is also the Director of Adult Social Services at Wakefield Council and the Director of Adult Community Services at our local NHS Trust. I have no idea how she balances those three roles, but that's what she does. So her role and then other joint roles that we have between health and the council mean there's better opportunities to join up our health and care system, creating a connected system that supports people in their homes and communities to live healthier, happier lives. This is one of the foundations for our Experience of Care network. So there was a King's Fund report published in 2021 which talked about how, as health services, we're really good at collecting people's experience of services at an individual service or a provider level. Think about patient surveys, think about friends and family tests. However, what this report recognised is that's not how people experience services. So how do services work together across a care pathway to meet people's needs? How do we get that experience? The report talks about poor experience of care is often when those services aren't coordinated, and was definitely reflected when Sarah spoke earlier. And gaps in care between services can disproportionately affect those with the greatest needs and end up with the poorest outcomes. So this gave us inspiration and an evidence base for our Experience of Care network. So how did we go about it? Well, we started with a bit of an idea, an open invitation to colleagues, a blank sheet of paper and some willing volunteers who helped us think through how could our network work. And what we created is a kind, welcoming and supportive space, a focus on pathways of care and a focus on what's really important to people. What does the data tell us that those things about experience of care that people are going through? And it gives us a shared view of experience of care for our population. We also created a space for peer support, where patient experience might be in somebody's job title in our larger organisations, to a person working in a voluntary sector organisation who does a bit of everything in their role and might want to think about experience of care. So the network was co-designed with our partners from our blank sheet of paper, and we developed some aims and objectives for our first year. And then we asked network members to think about what are the key words that we'd want to pull out, which feel most relevant, and ensured a collective ownership and understanding of our aims and objectives. And they're pictured there on that slide. So it's about ensuring the voice of people in Wakefield District influences the partnership's strategic work, their programmes for change, and so we can create that positive change for their experience of care.
So this one is showing the journey that we've been on since we started in November 21. You can see that we've had several meetings, several focused areas of discussion. Highlight of 2023 has been the Penner Awards in September. And what we've done since September is to hold another session of our meetings, which focus specifically around community mental health services, and we are already busy planning for next year and the meetings that will be taken into future. So in terms of how we run and report the session, each session has a reflective look at experience of care data and the top themes from what our people across Wakefield District telling us about their experience. And that is what helps us to shape the work. That is what leads us to have each session with a specific focus. And over the 12 months, we've covered different topics, as you've seen on the previous slide, and they have been varied. This slide also shows how we report, how we look at the information. It looks at the key experience feedback, what are people telling us. It looks at the strategic context and some of the challenges, and we share those in an open and transparent way to really provide context to the discussions. But as a network, we look at what our actions should be and look at them in a collective way, and each member always tries to help with whatever the actions might be from their perspectives. And we are keen in including small and big actions. So our key aim for year one was to establish the network and to grow its membership. And at the beginning, there were 8 organisations, including Healthwatch Wakefield, in the first development session. And since then, as the slide shows, we have grown to 16 organisations across the different sectors across Wakefield District. The spread of organisation is becoming diverse. We continuously getting new members, and we are continuing that conversation. And one of the things that has helped us through the Penny Award is to almost renew that conversation around the experience of care network, getting more of a publicity and getting that renewed interest in it. We also are keen about capturing the benefit for those who get involved. As one participant within our network said, it's not just about information sharing, but it is about focusing on actions, about focusing on learning solutions and support. When we started, we agreed to have success criteria that linked to our aims and objectives, and we had 4. One was a greater positive sentiment and experience of care feedback, and we saw a positive increase between Q1 of the two years that are noted on the slide, where we went from 19 to 31%. Now, we can't directly attribute the increase in positive feedback to the network, but through the network, we are getting more feedback and data as colleagues are sharing more with us, and we are continuously working on the sources of data. We wanted to demonstrate how feedback has informed and influenced improvement in service delivery and transformation. And again, we've done that in terms of our focus discussions at our meetings. Proactive engagement and commitment from all partners in the district was something that we also set out as one of our success criteria, and we achieved that through our increased membership. As my colleague already said, in terms of cherry on the cake or icing on the cake, one of our success criteria was to have a wider recognition of the network, and we were really delighted that we were shortlisted and successful at the Penny Awards. So as much as we were looking at our aims and objectives, our success criteria, and we did achieve those, there were actually additional benefits that we've had. And this slide really summarises some of the examples. The network has helped us to widen that information and range of feedback that can be used by organisations looking at relevant data, and it also champions the importance of working together to deliver those practical solutions for people to tell us what matters to them. So, for example, in one of our focused sessions that we had around access to GP appointments, we had a really good conversation, but what came out of that was what support needed to be put in place for patients in Wakefield District. And our Health Watch colleagues produce really useful how-to guides to support people in preparing and getting the most out of their appointments. Our network, as Laura said, it is looking and ensuring that the lived experience is considered within our planning, within our decisions and service delivery. And what has been great is the senior leaders within the partnerships are regularly making references to the network. They are talking about the value and outputs of the network and continuing that conversation around reflecting the lived experience in what all we do. This one captures some of the feedback that we've had from those who take part in the network. It also captured the feedback that we had from colleagues that we had during the Experience of Care Week, and it was really about having those pledges and conversations with our colleagues, and having the conversation during staff briefings and internally as well. The network does help us to have that single view of patient experience. It puts lived experience at the forefront of the services. And what we are proud of is the approach that we've taken, which is one of co-production, and it's been really valuable to have our Health Watch colleagues involved in leading the network, as well as bringing people's voice into the work that underpins the network.
So what's happened since Penna? So what winning the Penna Award has meant is it's really raised the profile of the network locally in Wakefield and across the West Yorkshire health and care system. We've written a blog, which I didn't even know what a blog was before last month. We've talked at various meetings, and we've reported through our governance arrangements into different committees. We've recruited some new members from the voluntary and community sector. So the recent session we had on community mental health services had a much better balance between statutory and voluntary agencies. We're also planning our second celebration event, where we're going to actually revisit a couple of topics that we've covered in the past year, almost to close that loop, to close the circle on actually what's changed since you came and talked to the network about that area. And we're going to invite partners to do a bit of a show and tell about some specific initiatives they've taken to improve experience of care for people. I think on a personal note, Darsha, Nick and I are really humbled that our network's been recognised alongside so many fabulous pieces of work that we heard and saw in Birmingham. In our fast-paced world, we rarely take time to reflect on our achievements, so the whole process of sitting down and thinking about our award application, writing the bid, to finding out we'd been shortlisted, to the day in Birmingham, it's just been really exciting and exhilarating, and if I'm really honest, actually a little bit overwhelming at times. But it's given us more impetus to continue to grow our network and really focused on the mantra of joined up care can only happen with joined up listening.